Hi everyone, good afternoon. This is Harriet. We apologize for the delay in the start of the webinars. We just had a few technical issues here and there. So we'll go on to our second webinar that's going to be presented by Medha. Medha is a Classic Scene at Glasgow Fellow, and she's serving at Nike Foundation. And the focus of our presentation this afternoon is going to be on paperless M&E. So I'll give it up to Medha right now to take us through her presentation. Thank you.
Thank you so much, Harriet. Thank you so much, everyone, for connecting with me today and dedicating your time to listen to this webinar. In about the next 20 minutes, I will try to talk about going paperless in terms of monitoring and evaluation, and also try to convince you a little bit that it's more than just saving trees. So on this slide, you can see that I have put an elephant with monitoring and evaluation, trying to say that as much as monitoring and evaluation looks like only a part of program implementation, however, it's actually much bigger than that, and it's much more burdensome because we come across real-life challenges such as access to limited budget or hard to gain access to data, and especially trying to reach out to hard-reach groups or in conflict situation. And usually what happens is one intervention is funded by multiple donors, which means that they would have their own monitoring and evaluation designs, which makes the whole intervention complex. And that's why Hello? Hello? Harriet, can you listen to me?
Yes, we can hear you. Please continue.
Okay, sorry. So yeah, so monitoring and evaluation, along with it comes real life lots of challenges. And in this slide, you can see that the use of mobile phone is growing everywhere in the world. So nobody would deny on that, I think. However, what's interesting in this chart is, for example, if we look at sub-Saharan Africa's internet users, which is shown by the orange line, and compare it with the mobile subscriptions in the same time period, which is shown by the blue line, you can see that there are much more mobile users as compared to internet users. However, when I'm talking about mobile users, it also means that they have access to internet. However, in the time period, in the last decades, though internet was able to create magic, the magic was not much huge as it was for mobile phone devices. So I believe that we are living the next generation that we talked about yesterday. Along with the advancement in technology and the use of mobile phone, something else is also growing. That is the growing interest on monitoring and evaluation. And we all know it's a very integral part of program implementation. And it's particularly gaining more interest these days because the donors and the program implementers want timely feedback so that the learning from one cycle can be implemented in the same cycle, unlike a few years back when you would finish the project, do the evaluation, and then implement the learning into another cycle. Another thing is we are moving towards more and more evidence-based decision making, and for that we need real-time data. The resources are becoming more and more scarce for development sector, while the expectations are growing. And then there is huge competition with so many nonprofit organizations coming up, and only those organizations that are able to prove that their intervention is worth value for money can only survive in the market, and that's what the donors want. So there's huge competition, and the concept of civil society participation, not only in planning of the intervention, but also through implementation and also in monitoring and evaluation, is growing. Civil society are getting greater voices, and there is heightened demand to access them in the monitoring and evaluation process, which means that In one way, there is increased interest in M&E, and another way, there is enhanced technology, is meaning we are demanding a rigorous and updated evidence-based monitoring and evaluation system. Now, there are several myths that might occur to anyone when we're talking about going mobile with monitoring and evaluation system. So let's go through some of them. The first one is, when we talk about mobile monitoring and evaluation, we tend to imagine that we need sophisticated devices like iPhone 6 or latest generation of iPads or so, which is not true. If you look at the dumb phones, which now these days we call them dumb phones because they're smartphones. However, they also offer the services of SMS, phone services, and interactive voice recording system, which means that we can do a huge amount of opinion polls, service delivery, feedback, sales and marketing analysis, and also we can monitor campaigns. So these are huge functions even on the dumb phone. However, a not so dumb phone would provide additional features like recording of the photos and videos, and also have access to internet. While smartphone, given their cost, they provide much more important features like, for example, besides SMS, phone, interactive voice recording system, video and photo recording, and internet, they also have the function of providing geographical information system. Another benefit of using smartphone is that they provide cloud backup system, while for the dumb phone and not so dumb phones, you might have to back up your data when you get access to internet, but with smartphone you can do it on the spur of the moment. And also they provide password protection facility so that you do not lose your data or some unauthorized person get access to your data. And then with the app function, you can generate your own software devices that can be tailored to your implementation. The second thing is that it's more expensive. It tends to look more expensive than investing in paper-based tools. However, let me prove you wrong by saying that when you use paper, the ongoing cost of printing, transporting, and storing of tools is much more higher, while for tablets or mobile devices, you need to invest only in once. That's like initial time cost. And it's easy to transport. You can just carry one device and it's going to work for everything. It's been proved that using mobile devices reduces 93.2% of data collection time. And of course, it's very environment friendly. We just talked about people and planet. So I think this is one point that's very important to consider. While the paper takes a lot of significant time and cost for data entry and auditing, this process is completely omitted when you're using mobile devices, meaning there is a dramatic reduction in data analysis cost. One disadvantage, however, is that if the device is lost, there is much more disadvantage. It's much more costly as compared to losing paper. But considering all the other facts, I would still give a tick mark to mobile devices. And let me give you an example. One program in Zimbabwe recorded a $10,000 saving by switching to tablets to survey 5,000 people as compared to using a 25-page paper questionnaire. That's another program in Kenya used as but instead of 150 to 200 individual calls per day, that would take 2 field officers full day perhaps to complete. Now with bulk SMS system, only one field officer needs 30 minutes to send out all the SMSs. So especially when you are going to the large system, to the large mass, mobile monitoring and evaluation system would be very beneficial. Another myth is that use of mobile can only be done at the phase of data collection. However, as you can see in this chart, I'm sorry if it's too small for you to view and read everything, but using mobile device is beneficial in all the process of your intervention, right from diagnosing so that it can give you broader participation at a reduced cost, or planning to get more inclusion and participation and more timely data. It's also very beneficial while you're implementing and monitoring to get real-time data, at the phase of evaluation to get higher quality of data, and while reporting, sharing, and learning to ensure wider circulation. Among all the different stages, if you ask me what's something that really interests me, which is a feature, then I would say the feature that mobile-based data would give you is real-time data, which means you monitor along with implementation so that you can get the real-time data at the spur of the moment. And this can be particularly very beneficial for behavior tracking interventions post your intervention, behavior tracking. For example, Akazi Kanozi Youth Employment Program in Rwanda makes young people take online quizzes from their mobile after the training and send the reports. Now, if you are using a big cohort of population and you want to gain data about their behavior in periodic time, then reaching out to them through mobile is much more cost-effective and time-effective than reaching out to them every time in certain periods of time. Girls Affect Mobile, which is the initiative of Nike Foundation's partnership with Facebook's Internet.org, which is a movement trying to provide internet service to developing countries, people who do not have access to internet. So what we have tailored that is to provide information to the girls. And while the girls are, we will also come to know which country's girls, which age of girl is using which kind of data more and what interests them more, so that when we implement it into another country, we can know how to tailor our program. Social media reference measurements, so that you can know which program or which intervention or which issue is gaining momentum, and through hashtags you can easily monitor it these days. When you're reaching out to mass population through mass media, such as TV, or how many people are listening to your program, or how they find the program, and which population, which demographics is here listening to your program more than others. So when you have a feature of feedback through phone, you can ask them to call you back or give you feedback, or through question answer in the program itself. What happens is you will know what kind of information given by your program is interesting, what kind of population, and which type of population is more interested on your show. Also, at individual level, especially in health sector, you can measure your own blood pressure or your glucose level using mobile phone devices these days. And what it means for the national data is that you can track them. Once a user takes his or her measurement and send it to the hospital, or can send it to the national data system directly, it's going to prevent a lot of time and resources for the country. Let's compare the use of these two devices at tool development phase. During developing a tool, using a paper provides maximum flexibility in formatting the tools, while if you use mobile devices, you have to follow the standard format that the software provides, which might at certain times be disadvantageous. And also, paper-based tools, they can be printed and they can be tasted immediately, while if you want to taste a mobile phone-based tool, then you have to complete the development first, 100%, and then go to the field, and only then can you taste. So in this case, I would give a tick mark to paper-based tools. Talking about the tools administration phase, writing on paper is easier, while typing on the tablets or mobile phone might not be as easy. And another thing is, sometimes there are responses that come out of the structured tool format. Through paper-based tools, you can easily keep a note of that, while if you're using mobile phone, it might not be, because it's a very structured program. However, One of the challenges that the research field has been facing is that the enumerators, they do not go to the field, they do not reach out to the population and fill in the data in their own room. So with the mobile devices, through its geographic information system, you can easily monitor if the enumerator has been on the field itself or not. And also, for illiterate population, it can be particularly beneficial. For example, when we administer tool, we take verbal consent from the respondent. However, we try to tell them that the response is going to be confidential, but at the same time, an enumerator is asking a question to the respondent, and the respondent might not be willing to share the truth, share the fact, because he or she knows that somebody is going to know the answer. But with tablets, you can give it to them and say, I would read out a statement, and you just press the green or the red button to say yes or no, or you can say whether you like it or dislike it, and so on. So the enumerator can read the statement while the person would click on the tablet itself. So that would maintain more of confidentiality and anonymity. Talking about large surveys management, using mobile device is much more beneficial because the logistics of printing and tracking is very tedious for paper-based questionnaire, and if there is anything that's need to be amended or changed, there's going to be a huge reprinting cost, while with the mobile phone devices, you can easily change. Even when you're in the field, you might have to change certain things, and you can just do it with single click. So it's going to be much more easier. The quality of data received through mobile devices is much more higher because with paper, there's issue in deciphering the selections and text. The data entry person might not understand the handwriting of the enumerator. And also, data entry is an added, very burdensome process, which also has a lot of chances of error. While using mobile devices, it has been proved that there is 93.2% reduction in errors as against paper-based devices. And also, the time gap between when the data is collected and the time between when the data is available for analysis is huge in terms of paper-based devices, because you have to enter. There's a big bulk of steps. While if you use mobile devices, then it will automatically prompt the enumerators for any answers that have been unfilled, so it will give you red marks, and so there is much lesser or lower missing data. Data cleaning is much more easier, and there is lots of reduction in cost and lots of reduction in error. Oftentimes, we do not collect information for monitoring and evaluation just through one tool. So when we are using multiple sources of information and triangulating the information, the paper-based device would need another audio device or another GPS device or video device, whereas a mobile device would be one-stop device for both the text and non-text data, because they can do various functions of photos, videos, and text-based system. Also, if you want to implement randomized controlled trials, the randomization becomes much more scientific because it's computer-based, and triple blinding is possible, as against paper, where only single and double blinding is possible. And if you want to do sociometric analysis, or you want to do community mappings, or also for crowdsourcing, you want to involve the population, the beneficiaries, into concept developing phase, then this is going to be much more easier. And even if something happens in the field, to report the incident, it becomes easier, not only easier, but also scientific, because you can easily record the time and the geography of the place where the incident happened, and so that you can map them. Also, if you want to reach out to sensitive groups, for example, commercial sex workers or drug users or abortion seekers, it's easier to reach them out through tablets, because with paper, there is face value. You have to respond to somebody else. So the person would not be very open to the responses, whereas if you reach out to them through mobile devices, then they would they would have much more high response rate, which has also been proven through several studies. And also in conflict-affected areas, for example, the World Bank implemented a program in South Sudan where they distributed phones to different households, and every month they would call from Nairobi, and through remote calls they would gain the information that they desire. So sometimes it might not be very safe for enumerators to go to the field and collect information, and in these cases, again, using mobile phone would get a tick mark. I cannot end this webinar by just saying the good points of the monitoring and evaluation using mobile phone devices. So I would like to take some time to highlight the challenges. The first challenge using mobile devices, there is selectivity bias, meaning you're only reaching out to the population that can afford mobile phone devices, or even if you reach out through your own tablet devices, there might be selectivity bias, meaning there might be wealth bias or bias, etc. You might just reach out to certain age group that use mobile phone more than others, or certain gender that use mobile phone more than others. Another is technology phobia, which means that if an enumerator goes to a household carrying a device that has features of recording the voice, recording photos, videos, then they might feel like you're a journalist or something, and then they wouldn't be very open to giving real information. It's a technology-driven tool, which means that there is limitation. The only things that the software can provide can only be implemented. So if the software company or the pre-built software has certain features that you want to modify or something, it might be difficult. So there is limitation of that. And also when you use mobile devices, there is technological problems that might lead to data loss. For example, electricity, or your data getting lost when you're backing it up or something, or maybe the person who is using the device does not have enough capacity. So it's shown that around 7% of the data collected through this process gets lost, which also means that it's advised to increase your sample size by 7% when you collect the data. The beneficiary interaction is lost, meaning the information, the qualitative information you would receive by going to the field itself and collecting the information, and you could see around and you would get much more information solely through observation. But using devices and sitting from office and calling them would prevent those kinds of interaction, and so the focus would be much more on quantitative data. Also, the use of mobile technology has been growing for monitoring, and its use has also been hugely proven for monitoring, whereas its use for evaluation has been limitedly studied, so it's not yet proven much. I would like to conclude my presentation by saying that post this presentation, you can either go to one way and yes.
Yeah, just try wrapping up, and
yes,
you can take some of the questions. We have 5 minutes before we can conclude this webinar.
Okay.
Okay.
Okay, sure. So I'd just like to conclude by saying that you can go to the good side of the monitoring and evaluation mobile-based M&E and look at its efficiency gains, better quality, reduced cost and resources, or go the other way around and look at its technology breakdown, staff capacity, and such disadvantages. But I would just like to say that technology is no good without human thought behind it. So I hope after this presentation you can implement it to your own activities. And now I'm going towards the question and answers. Could you please cite examples of mobile application used for M&E, if any, as a point of reference? Okay, I can give you like some of the examples I mentioned in the presentation, but I can send you some other examples after this webinar, Karuna. And M&E is an integral part of any project. However, the donors are always stringent when it comes to cost. Do you think this sophisticated systems for M&E will fit into the budgeting phase? Exactly, this is what I was trying to say. With the donor demand, otherwise, there's limited cost, there is higher donor demand, but while we might think that it's expensive, it's actually there's at least there is a reduction in the cost over time, and especially when you're reaching out to large survey populations, there is significant reduction in cost. Crowdsourcing is a great way to monitor, but carries a high degree of uncertainty with regards to authenticity of info, as opposed to actually reaching out to the beneficiaries with a questionnaire. How do we ensure accuracy of this monitoring information system? So the only way to prevent this is providing the questionnaire or the tools only to the authorized email address. Like, for example, even when Atlas Core is sending to us, other people cannot gain access to it. So, John, I think that's one way where you can make sure that there is a degree of authenticity on it. Michael said, how does users of mobile phone device help in reducing the rate of corruption in monitoring and evaluation? Well, I don't I don't think there's corruption in M&E, but there might be corruption in hiring the devices or hiring the people and so on. Coming from a developing country where there's really high rate of corruption, it's very hard for me to answer this to you because it's a very difficult system. But I think using paper wouldn't serve that problem anyway. So I think you would be able to answer this better than me about how we can reduce the corruption. What about the people who did not operate a mobile smartphone properly? If they need training even, there is a cost implication. What do you think? Yes, definitely. There's cost implication on both sides, because you have to train the enumerator, and also you have to make sure that the person you reach out to knows how to operate the smartphone at the basic level. But what's interesting is the growth of mobile phone use has been growing exponentially, and they have been reaching to very many corners of the world, all around the world. So it's not as bad. I mean, the use of mobile phone has been growing so much that you wouldn't realize that you can actually reach to much more population than you would actually think about it. So yes, obviously you wouldn't be able to reach out to everyone, but then you would be able to reach out to significant number of population. That's what I can say about it. And then Karuna says, sorry, I submitted before, okay, completing my question. I was wondering if there are any data that are available of the examples you have given for measuring the impact of Girl Effect mobile project. For example, what was the method of feedback applied here? Okay, so what we are doing is it's a system where Facebook is distributing mobile phones to the population, and then there is already built-in information system which they can retrieve anytime. The benefit is that it's providing internet at much reduced cost, and the amount of data that you provide is also significantly reduced in size, so that they can access internet in much more internet in reduced cost. So one of the tabs that they can access is information about girls. So there are very many useful information about improving their life standards, their health, their use of technologies, and so on. So what we can measure from here, from Nike Foundation's office, is who is using which device and what age group of girls is looking at what kind of information, which part of the world or which part of the country is accessing what kind of information. So it's easier for us to map what information is being viewed more against others. And for example, if we want to reach out to Tanzania and then we already have information from Kenya, we can, when we are designing our program for Tanzania, we can replicate the information that we have received from Kenya and so on. How you see M&E in next 5 years for wide-scale programs? Will it replace paper-based M&E, or B, it will be supplementing the existing system? For this frame, I think that it will replace, if not completely replace, but it would have already overshadowed, because for large-scale surveys, the companies have already started using mobile phone device because it's going to give them value for money over time. For example, the National Demographic Health Survey in Nepal uses tablets. And also, as a grant manager, what I have observed is so many of the proposals that I receive these days have money for buying tablets for their monitoring and evaluation system, which shows that it's going to get much more higher. And I told you about the advantages of using it and the disadvantages of not using it, which shows that the development sector is much more interested in mobile-based monitoring evaluation these days. So I don't see any more questions. So I think that's it. If you have any more questions, you can post it, and I can try to answer it. Harriet? Hello?
Hi, Medha.
Oh, okay.
Oh, yes. Yeah, I think you've answered all the questions that have been posted. If there is any other fellow that still has a question, maybe they can send them directly to you, and you can respond to those and share the responses with the rest of the fellows. Otherwise, I'd like to thank you so much for this great presentation. It's been really great and enriching and well researched. And I hope the fellows have really taken a lot out of it. So I think we come to the end of our second webinar. Thank you everyone for tuning in, and thank you for your contributions and engagement. And we'll be seeing you next month for our next webinars.
Thank you so much, everyone, for connecting.
Okay.